Today, I'm here to present on the topic obesity. Obesity is a condition in which a person is overweight or obese, which is due to the deposition of fat in the adipose tissue. And this is mainly due to the consumption of excess amount of fat in the food. And this excess amount of food consumed is converted into fat and stored in the adipose tissue, which leads to obese. And it is a common among people living in western countries and among the higher income groups in India and other developing countries. The person is said to be obese when the body mass index is 30 or greater. So this slide shows about the obesity versus overweight. So which is a causative factor for several chronic non-communicable diseases including heart disease, diabetes and certain types of cancers too. So overweight, the person is said to be overweight when they are having fluid, fat, muscle mass, bone, tumors, etc. And obesity is totally um, the deposition of fat in the adipose tissue. Epidemiology. It is nothing but a prevalence. The worldwide prevalence of obesity is nearly tripled between 1975 and 2016. In 2016, more than 1.9 billion adults 18 years and old were overweight. Of these, over 650 million were obese. And over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. So measurement of obesity. So what are the ways to measure the obesity or BMI, that is basal mass index. Next is waist hip ratio and skin fold thickness, air displacement, phlegethysmography, total body electrical conductivity. So these five are the detectors for measuring the obesity. So let's see about the air displacement phlegethysmography, that is simply said as ADP. So here mainly the body volume, that is density of fat free mass, is variable by age and is estimated. And the prediction equation relates mass and these densities to yield fat mass. That is fat mass, fat free mass, percentage body fat. That is in the abdomen, the fat deposition is there. You can observe in this slide. So that is if the person eats overweight and particularly if overindulge in unhealthy foods, it can suffer from food obesity. So excessive sugar intake can also cause food obesity, which may lead to accumulation of fat around the middle part of the body. And anxiety obesity. It is said to be, we all know that anxiety is otherwise called as depressions, and it is often lead to overeating and accumulations of fat in the body, since the body must constantly survive in fight or flight mode. So to treat this type of obesity, we must control our body. So common treatments include medications or decrease in caffeine intake, that is coffee. We should avoid coffee. Venous obesity. So venous means blood circulation will be there. We all know that. So venous circulation is one obesity which cause genetic in nature rather than habitual in nature. If anyone is suffering from venous obesity, it is the risk of the same conditions. The type of obesity is particularly common pregnancy, and exercise is the best solution for this problem. Then gluten obesity. It is likely no stranger to the many health problems that gluten can cause. In fact, gluten can actually cause obesity. And this type of weight gain is most common in women It is often spotted during periods of hormonal changes like puberty, pregnancy, and menopause. The next comes atherogenic obesity. Here, the people whose fat tends to accumulate in the stomach area often suffer from atherogenic obesity. This is a particularly dangerous condition since it can affect our organs and lead to breathing problems. And it is extremely important to avoid drinking alcohol if you have atherogenic obesity. Then etiology and occurrence. That is mainly by age, economic status, physical activity, and proneness to obesity. Then this slide shows about the role of nutrition in obesity. So nutrition plays a major role in order to control obesity in individuals, and intake of healthy diet is very important to reduce obesity. There are several fat burning foods which should be taken in order to fight against obesity. The fat burning food include red pepper, whole grains, low fat dairy products, lean meats, green tea, etc. And dietary modifications. Weight reducing diets must be rich in proteins and low in carbohydrates and also in fats. First one will be lowering the fat content of the diet. As fat contains more than twice the calories, that is 9 kilocalories per gram, compared to protein, that is 4 kilocalories, and carbohydrates is 4 kilocalories, weight reducing diets should limit the fat intake and keep total fat intake between 20 to 35% of calories, and a limitation of intake of fats and oils high in saturated or trans fatty acids, and choose products low in such fats and oils. And we should consume less than 10% of calories from saturated fatty acids. And next comes we should consume less than 300 milligram per day of cholesterol and trans fatty acid consumption as low as possible. When selecting and preparing meat, poultry, dry beans and milk products, make choice that are lean, low fat or fat free. And second one will be low carbohydrate diets, and it is the glycemic carbohydrates, that is refined carbohydrates, which promotes fast absorption of glucose, which is also need to be restricted since it may prone to cause DM, that is diabetes. Plant foods that provide complex carbohydrates and fiber may be preferred as they reduce blood glucose, cholesterol and TG. A daily limit of 0.7 to 2 ounces, that is 20 to 57 grams of carbohydrates, is typical with a low carbohydrate. So these amounts of carbohydrates provides 80 to 24 calories, and fiber rich foods or chosen, that is rich fruits, vegetables, whole grains, or to be taken often for low carbohydrate diet. Rich foods such as fruits and vegetables, which are having more amount of potassium, so that we can gain some minerals in our body. Then refined sugars, that is 4 kilocalories, and alcohol 7 kilocalories, provide empty calories and should be avoided. So these kind of calories taking from refined sugars and alcohol should also be avoided. And foods and nutrients to increase. What are the nutrients to increase? That is to increase vegetables and fruit intake. Eat a variety of vegetables, especially dark green and red and orange vegetables, and often beans and peas. And you should consume at least half all grains as whole grains. Increase whole grain intake by replacing refined grains with whole grains, and increase intake of fat-free or low-fat milk and milk products. Then high protein intake is commonly recommended to help people to manage body weight. That is black beans, corn, salmon, that is fish, cauliflower, broccoli, Chinese cabbage, eggs, lean meats, lentils, nuts, seeds, protein, powder, yogurt, that is curd, and light cheese. Then, an increased intake of dietary fiber appears to be useful for the treatment of both obesity and diabetes mellitus. So this is a obesity diet chart which shows the how much amount we should consume per day, that is in kilocalories. Total calories are mentioned here. The timing is given in the left chart, and the what type of fat, calcium, sodium, minerals, what type of food you should take in that time. It is mentioned uh, in the right chart. The timing will be 9, 11, 1, 4 and 8, and total fat we should consume is 22 grams per day. Calcium 600 milligram per day. Sodium 1000 milligram per day. And carbohydrate 280 gram per day. And protein 70 gram per day, and iron 17 milligram per day. So totally it is said to be having 1600 kilocalories per day we should consume for diet to control the obesity. Then very low calorie diet, that is VLCD. They defined as diet providing less than 1000 calories per day. We recommended to use moderately severe obese persons under close medical supervision. Moderate obese patient, while going for this kind of diet, causes a symptoms of sweating, feeling hungry, and feeling low on energy. So behavioral and lifestyle disease or lifestyle factors. It includes unhealthy dietary patterns, less physical inactivity, medication, that is frequent use of medication, easy availability of fast food, unfavorable physical activity environment, less education and skills, food marketing and promotion. Healthy consequences of obesity. According to CDC, obesity affects all organ systems and creates adverse health effects. That is, which all its affects is hypertension, dyslipidemia, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, etc. So this type of disease will occur when the person is having healthy consequence of obesity. And preventions. Prevention is counseling and approaches, physical activity and exercise, aerobic exercise. Counseling, discussing about the weight control, intervention for overweight patients to prevent the progression of obesity, and physical activity and exercise to encourage adults and children to engage in regular physical activity and decrease sedentary activity. Aerobic exercise, at least 150 minutes of moderate intensity exercise weekly, at least 75 minutes of vigorous intensity exercise weekly. So this type of exercise for the particular minutes are said to be aerobic exercise. And then diet and eating. The obese patient or obese person should promote to consume of a variety of nutritious foods and recommend avoidance of high calorie foods and sugar sweetened beverages. And they should encourage and support breastfeeding during infancy, encourage families to create a healthful eating environment that is responsive to hunger and fullness cues. Thank you.